ethmoid bone is irregular. And you can see it with the, here. This is an irregular bone. It's called the ethmoid bone. Ethmoid. And this is fair game for your practical as well, because I think it looks so unique that you can't mistake it for any other bone. So I could have the sphenoid and the ethmoid at a station, and I could ask you to classify it based on its shape, regular, and then I can ask you about surface markings. Okay, so the first surface marking is the fin. This is called the crista galli. It is the fin here. And what it does is it pierces the outer membrane protecting the brain, anchoring it into position. That outer membrane is called the meninges. Okay, it's actually 3 layers. It's called the crista galli. It's called the crista galli. Crista galli. Now, okay, just to acclimate, this subject is facing you. This subject is facing you, okay? And so is this subject, right? But when I turn it so that you see inside, can you see the crista galli right here? So I'm going to turn it so that you can see the crista galli as well. Can you see the crista galli on both? This one is more profound than the plastic model. And the plastic models come in different qualities as well. So, crista galli, crista galli. Crista. There are 2 flat plates of bone that lie lateral to the crista galli. 1, 2. They're called cribriform plates. Cribriform plates. Cribriform plates. They lie lateral to the crista galli. So they surround the crista galli. They are flat plates of bone called cribriform plates. And they have like a bumpy appearance, but those are supposed to represent little holes. Cribriform plates. And the olfactory nerve endings penetrate these holes, enabling us to smell. Cribriform plates. There's an R there. Cribriform plates. Here's the crista galli. You see the 2 plates right here and here. Cribriform plates. Cribriform plates. 1, 2. Are you okay? Cribriform plates. Now, whenever the ethmoid bone is removed from the skull, you can see what we call the superior nasal conchae. Concha is 1. Now, conchae are basically plates of bone that warm and moisten the air that we inhale through the nose. Now, do you see this protrusion right here and the other on the opposite side? That's part of the superior nasal conchae. You cannot see the superior nasal conchae in the intact skull because they are covered. You can only see them when the ethmoid bone is removed. Do you see this plate of bone here? This is part of the superior nasal conchae. Superior nasal conchae. Superior. Middle nasal conchae, do you see this right here? See this right here? This is part of the middle nasal conchae. Do you see that here? Middle nasal conchae. Superior, middle nasal conchae. Superior, middle nasal conchae. Do you see the difference? Superior nasal conchae here. Middle nasal conchae here. Isn't it true that the middle nasal conchae are inferior to the superior nasal conchae? In the intact skull, you do see the middle nasal conchae, which I'm pointing to right now, 1 on each side, but you cannot see the superior above because they're hidden. You must be careful. Please do not ID this as superior nasal conchae. This is middle nasal concha. Middle nasal, 1 on each side of the nasal cavity. Do you see it? Middle nasal concha. middle nasal concha. This is called the middle nasal concha, the plural form middle nasal conchae. Are you okay? I'd like to move on, please. The line in the center of the nasal cavity is called the perpendicular plate. It's part of the ethmoid bone. Now, it's not this entire line. It's what I'm touching up. So, what the tip of the pointer is touching, that region and superior to that is called the perpendicular plate of the ethmoid bone. Do you see it? The perpendicular plate of the ethmoid bone. Perpendicular plate of the ethmoid bone. Of the ethmoid bone. Perpendicular plate. That helps to form the partition that separates the nasal cavity. It's called the septum. However, the bone below that I'm touching right now is not part of the perpendicular plate. This is called the vomer, V-O-M-E-R. It is its own unique bone. Please note that it is its own separate bone, but they unite. The perpendicular plate of the ethmoid bone, along with the vomer, fuse together to create the partition called the nasal septum. Vomer is on the other page of your outline. It's a part of the facial bones. Are you okay? Okay. Here we go with the ethmoid one more time. Do you see this line right here? This is the perpendicular plate. You see it? See how the perpendicular plate lies between the nasal conchae? The perpendicular plate, that line there. Perpendicular plate. Perpendicular plate. But please note that the perpendicular plate is not the only structure that forms the partition. It's also the vomer that unites with the perpendicular plate. We don't see that here.
Could you, by any chance, point out the cribriform plate one more time?
The cribriform plates are here. These flat plates located between the crista galli. Okay?
Thank you.
You're welcome. They're called cribriform plates. Are you okay? We've just completed the cranial bones. Now we end with the facial bones of the skull. Okay, they do not play a role in protecting the brain. Okay, let's begin with the maxillae, also known as maxillary bones. There are actually two of them, but they fuse in the center. We're not going to go into that detail. We're just going to call them maxillary bone or maxillae, if you don't mind. This is one maxillary bone here. Maxillary bones, you've got it. These are the maxilla or maxillary bone. Okay. These bones have several surface markings associated with them. The pointer is in one of the two infraorbital foramen. Infra, below the orbit. Infraorbital foramen. Infraorbital foramen. Infraorbital foramen. Is it true that the supraorbital foramen are associated with the frontal bone? The infraorbital foramen are associated with the maxillary bone. Then we come to the palatine process, incisive foramen, inferior orbital. Okay. Is everyone okay with where the inferior orbital fissure is inside? It's repeated several times, I understand, because several bones help form it. Part of the sphenoid and part of the maxillary bone, right? Help form the inferior orbital fissure, just for clarification here. Inferior orbital fissure. Inferior orbital fissure, you see? Can you see why I wouldn't just ask you about the inferior orbital fissure by just having the sphenoid bone? I could, but it's better if it's it's the sphenoid and the maxillary. I'd like to move on, please. Incisive foramen and palatine process. Okay, this is the maxillary bone, not a problem, right? This is a part of the maxillary bone. Remember you were looking at this earlier? Okay. These two plates that you see here are part of the maxillary bone. They are called palatine. There's no N. Palatine. palatine processes. Palatine processes right here. But they end here. These are not palatine processes. These are part of the palatine bones. They're their own unique bones. So I'm probably going to point up here for the palatine processes. Palatine processes. Don't they help form the hard palate? Palatine. Aren't they what does not fuse correctly with a cleft palate? A cleft palate? Palatine processes. Now we come to the incisive foramen. You got it. Okay, these are the incisors here. So these are the incisors. So this hole between the two incisors is called the incisive foramen. Incisive foramen. Now, there are vessels that pass through that foramen. We just can't feel them completely because of the skin that covers, the gums that cover all those vessels. Incisive foramen. Incisive foramen. You can also call it fossa. That's why I have it in parentheses, because there are some texts that use fossa. I don't really understand, because the fossa is like a groove, but they interchange those terms sometimes. Are you okay with incisive foramen? I'd like to move on to palatine bones. Again, let me just repeat this one more time. The palatine bones are the most posterior. They are posterior to the palatine processes, and I would probably put the tape at the end here so there would be no question that these are the palatine bones. They too help form the hard palate. Palatine bones. They are posterior to the palatine processes. Palatine processes are part of the maxillary bone, right? I'd like to move on. The zygomatic bone is your cheekbone. So you should be able to recognize the maxillary bones and the zygomatic bones. Now there's a surface marking called the temporal process. This is a protrusion of bone that's a part of the zygomatic bone. We call this the temporal process of the zygomatic bone. It's called temporal process because it's moving in the direction of the temporal bone. Temporal process. Do you see that little ridge of bone that continues out away from the zygomatic bone? It's called temporal process. Isn't this the zygomatic process right here? Zygomatic process. Is it true that the zygomatic process and the temporal process form this arch right here called the zygomatic arch? Okay. Are you okay? I'd like to move on. Lacrimal bone. Okay, now we go into the orbit. Now, if you look in the skull, at any skull, you'll see a little hole. This is called the lacrimal fossa. This is the tear duct where tears are drained. Lacrimal fossa. Now, the small bone surrounding the fossa is called the lacrimal bone. Look for the fossa inside along the medial aspect of the orbit. You'll find this hole. Where do you find the hole? You find the lacrimal bone. It's a very thin bone that surrounds the lacrimal fossa. And the plastic model shows the border of that bone. It's kind of hard to see, but if you look closely, I'll be right back. Can you see that border, the little line here, like right here? It's not perfect.
It might be easier to see on this one.
Yeah, it is, because of the authentic skull. Definitely. You got it. It's very clear. If you could take a look at that authentic skull, that'll give you a better perspective.
Only one of them's, I think the other one might be covered up with something.
Okay, but it's very clear, because a lot of times I'll use that for that fossa and for that bone. Thank you.
That's.
Okay, nasal bones.
But on this
Nasal
side,
bones,
it's
you
not
don't
visible.
have a problem with nasal bones, right? Those two thin plates of bone right here, the nasal bones. Aren't they super